Oklahoma's mental health and substance abuse services are in a stranglehold as the legislature heads into a second special session to come up with a solution to the state's budget shortfall. Good evening. I'm Maria Garcia. The legislature's first special session resulted in a mostly vetoed plan by Governor Mary Fallin. She said that the plan was disappointing and was not a permanent solution to our budget woes. The governor did pass some short-term funding to cover agencies like mental health and substance abuse services, but that money will not last. In the meantime, Oklahoman lives hang in the balance.
Schizophrenia is very traumatizing. When I was first diagnosed, as soon as they told me that, I kind of knew it was the beginning of the end.
Pia Hildebrandt lives a mostly independent life, but it wasn't always that way. When she was first diagnosed with schizophrenia, life spiraled. Her family's support and state help got Pia on the right path. The face of mental illness could be anyone's face. This disease does not discriminate.
I don't know how to describe it. I just know I'm different from other people. I mean, I'm fine with the way I am. It's just kind of hard to get along with other people who are normal.
Rachel Bradley is a girl with many talents, but also many struggles. She is diagnosed with schizoaffective disorder bipolar type. She's also on the autism spectrum. Uncertainty is causing mounting stress for service providers. Will they be out of a job? And for people trying to live happy and healthy lives in spite of their mental illness.
It's terrifying. It's scary. People are losing services. Families do not know what they're going to do, how they're going to help their loved one.
Rachel, a teenager, has to have honest talks with her mom about what losing care could mean.
Makes me kind of nervous about when I grow up and my mom's not going to be here. Yeah, at least I'm getting better.
For Pia, that question mark is still hanging over her head. The reality is that losing her mental health providers, losing her affordable medication, means losing her life as she knows it.
If I didn't have the medicine, I would be so sick. I could be on the streets, I could be homeless.
Fox 25 has committed to telling people's stories so that we don't forget the realities of Oklahoma's mental health crisis. We've done that through 30-minute specials, weeks of dedicated coverage, and phone banks trying to connect people with the answers that they need. Now we go beyond the sound bites, bringing the experts to you. Tonight, Fox 25's Wendy Suarez sits with mental health professionals and providers. We'll address the issues and take your questions in this Fox 25 Your Voice, Your Future Town Hall.
And thanks so much for joining us for this roundtable discussion on such an important topic as Maria's story just showed us. I want to introduce the panel of experts we have with us. All the way on my left is Verna Faust from Red Rock Behavioral Health Services. We have Commissioner Terry White from the Department of Mental Health for Oklahoma, and Ashley Burke from Thunderbird Clubhouse. Both Thunderbird and Red Rock depend on state funding to help provide the services that you do. So all of you are very aware of the situation we're in right now. And we were hearing just in that story how people who receive these services, as well as the employees, are feeling nervous right now. I'd like to start off by asking, what's the state of services available to people seeking this kind of help right now?
So the background, just walking into what's going on in Oklahoma, right now 1 out of 3 Oklahomans who need help can get it. So 2 out of 3, the door is too narrow to let them in. What happened just a few weeks ago is that when the cigarette fee was overturned, the Department of Mental Health and Substance Abuse Services took a $75 million hit, just like that.
So that's in effect right now.
That's 23% of our budget. And what we do is we fund private entities primarily. Most services aren't delivered by the state of Oklahoma, and I think most people know that. It's private nonprofits who are on the ground delivering these services, and that's where our budget goes. Mm-hmm. The good news is the governor and the legislature took step 1 by taking our budget hole down to $52 million. A couple weeks ago took step 2, got it down to $21.5 million, and now we are all desperate and dependent that this last step happen, that they get us to 0 cuts, because for every $2,000 we lose, that's services to an Oklahoman.
It's been a battle at the Capitol. Legislators agree and disagree on ways to keep state agencies funded and fill that $215 million budget shortfall, while Oklahomans wait with bated breath, trying to see if their life-saving mental health services will be lost. Pia Hildebrandt lives a mostly independent life, but it wasn't always that way. When she was first diagnosed with schizophrenia, life spiraled.
Well, schizophrenia is very traumatizing. When I was first diagnosed, as soon as they told me that, I kind of knew it was the beginning of the end.
Family support and state help got Pia on the right path. Pia's mother, Ruth, is an advocate for her daughter. She says support meetings with the National Alliance on Mental Illness have let her know she is not alone. Ruth sees everyone's fears firsthand.
And I can't imagine the people whose parents are too old or not there or are doing it on their own, because this is the kind of disease where you don't often have family support.
NAMI says that no matter what happens, it plans to continue its family educational programs. Those devastating cuts would have a profound effect, leaving NAMI nowhere to direct the people who are suffering.
It's terrifying. It's scary. People are losing services. Families do not know what they're going to do, how they're going to help their loved one.
As for Pia, that question mark is still hanging over her head. The reality is that losing her mental health providers, losing her affordable medication, means losing her life as she knows it.
If I didn't have the medicine, I would be so sick. I could be on the streets, I could be homeless.
If lawmakers take no action, the Department of Mental Health and Substance Abuse Services says that it will be forced to cut all of its outpatient services. But here is the reality. Even if a budget deal is reached soon, cuts are likely anyway. Maria Garcia, Fox 25 News. There has been progress, but the stigma attached to mental illness is still real. It can show itself in different ways depending on your community. Advocates are fighting for everyone, but if there's no funding, all those touched by mental illness will feel it. Everyone suffers from mental illness, but the National Alliance on Mental Illness says that the African American community has to deal with additional barriers because of unmet needs. This includes a lack of access to mental health care services. If untreated, mental illness can often cause a person to end up in jail. According to the latest available annual report from the Department of Corrections, the African American community is the most overrepresented minority group. In that same report, the Department of Corrections shows that 60% of its population has a history or current symptoms of mental illness. Last month, rallies at the Capitol brought out Oklahomans to say, enough, mental health should be a priority. One of those people is Devin Denton, an ER nurse.
You are making it super difficult for us to treat. You are cutting off services and holding beds for patients that may have cardiac issues.
Denton says that if services are cut, she expects a flood of people in emergency rooms who need emergency help for their mental illness. This will put more strain on the system and create longer wait times.
Please stand up for mental health awareness and, save our services.
There has been less mental health and substance abuse services available over the years as the state deals with continued budget cuts, this increasing one of the barriers faced by minority communities and access to care. Maria Garcia, Fox 25 News. The Latino Community Development Agency serves as a lifeline to Latinos in many different ways, and one of those is bilingual mental health services, something that could be nearly eliminated with a cut in funding. A budget standoff at the Capitol means state agencies are facing deep cuts. The Department of Mental Health and Substance Abuse Services is looking at the real possibility of ending all outpatient services. This means ending contracts with places like the Latino Community Development Agency.
To receive services or treatment for mental health is essential, not only for the Latino population, but for everyone in the state of Oklahoma.
Janice Esparza is Director of Treatment Services. She says Latinos in Oklahoma face specific barriers to mental health care access. That's on top of the long-standing stigma every community faces. For some in the Latino community, there is a lack of trust in government agencies and the language barrier.
Latinos, they don't go just anywhere. First of all, they go to a place that they speak the same language. They feel comfortable. That's why the Latino Agency for so many years have been providing linguistically, culturally competent services.
If the Department of Mental Health and Substance Abuse Services is forced to end all outpatient services, the Latino Community Development Agency could lose between 12 and 15 bilingual therapists. Services for adults and children alike would be limited or non-existent. If services are cut, it will take much longer than a good financial year to revive the mental health system in Oklahoma. Esparza says that if these cuts happen, Oklahoma could lose 75% of its therapists, and that you'd be hard-pressed to get those people back in once the state figures out its budget. Maria Garcia, Fox 25 News. All week, we've been talking about the looming and devastating budget cuts to Oklahoma mental health services. And here's the thing. Cuts have been happening for years. Even if outpatient services aren't cut now, there's still an overarching problem, meaning that we'll be having the same conversation next year. It's a pain the Bradley family knows all too well.
It's a picture of the World Tree in a mystical land where fairies exist.
Rachel Bradley is bubbling with excitement at this meeting in the Fox 25 studios. She is 13 and eager to show off her drawings. They are imaginative and each one has a story. Rachel is a girl with many talents, but also many struggles. She is diagnosed with schizoaffective disorder bipolar type. She is also on the autism spectrum.
I don't know how to describe it. I just know I'm different from other people. I mean, I'm fine with the way I am. It's just kind of hard to get along with other people who are normal.
Rachel's mother, Suzanne Bradley, is a speech therapist forced to work part-time to take care of her child. It's been a painful road. Every time there's a breakdown, Rachel ends up in Tulsa because there's no place for her anywhere else. They're from Norman, Oklahoma. The worst time when Rachel was a small child.
She went by a police car in handcuffs. It was a terrible thing. She was really, I think she was 7. She was either 7 or 8, going in handcuffs by herself from Norman to Tulsa.
It's been nearly a decade of figuring out the right types of medication for Rachel. If it's not the right cocktail, things can go wrong.
I followed them all the way to the hospital, and I was incredibly grateful to them. It was a horrible experience.
Rachel knows the Oklahoma legislature is considering more cuts to mental health services. The services her family depends on.
Makes me kind of nervous about when I grow up and my mom's not going to be here. Yeah, at least I'm getting better.
Suzanne Bradley says that she has thought about leaving the state to get her daughter more dependable help. The problem? Her community is in Oklahoma. Extended family and support groups with NAMI. Those support systems help with the survival. Maria Garcia, Fox 25 News. Mental health providers tell Fox 25 that they have been in contact with their legislators regularly. They're trying to get a straight answer and say they're not getting one. So the question remains, what comes next for mental health services in Oklahoma? Thunderbird Clubhouse in Norman, Oklahoma. People are developing their communities and learning to work. Many of the members are recovering from mental illness. Pia Hildebrandt is a member here.
I'm very thankful for it. I'm very thankful for being able to be independent. I get help through Thunderbird Clubhouse, PAC Team, and Norman Section 8 Housing Authority. And I have Medicare insurance. And if they were to cut back any of that, I wouldn't have a psychiatrist, a therapist, affordable medicine.
Executive Director Lynn Blom says that she has seen the legislature slowly dismantle the state's ability to provide help. The threat of even more sweeping cuts to fill a $215 million budget hole is frustrating.
Mental health traditionally has taken cuts in the last couple of years. We're not just asking for cuts to stop. We're asking for restorative funding so we can get back to a place where we're healthy again.
How deep the cuts will be, that's still unclear. Pia's mother Ruth says any more cuts are a sign Oklahoma is not willing to take care of its people.
They couldn't be cut prior to the last cut. And now you're going to cut them some more. And what do you think is going to happen to these people? Those costs are going to shift.
Mental health care professionals say less mental health services will mean more homelessness, more incarceration, and the possibility of more suicides. Blom says these facts should be enough to stop the political game, but it hasn't been.
Just fix it. We want to put aside the differences and just fix it.
As it stands now, mental health and substance abuse services will be cut by an estimated 23%. That means cutting all outpatient services by December 1st this year. Maria Garcia, Fox 25 News.